Go ahead and start recording. And Annabelle, you can gavel us in.
Okay, we're starting at 5:31.
Perfect. Okay, we are to order.
Okay.
And we will do a roll call since we have Jennifer remotely.
Oh.
Director Jeffries? Here. Director Conseco?
Here.
Thank you.
And we have no public comments because nobody's here. And other than Jennifer, we have no one remote, and we had no emails from anybody with questions. So with that, I'll just jump into the discussion item. So really, it's just letting you all know that when Prop 50 change goes into action, which will be this year, our district will move out of District 48, which was Daryl Issa for the last 8, 10, forever, to District 49, which is Mike Levin. That puts us in line with folks who are in San Juan Capistrano, so Southern Orange County, all the way down to just about, I think, Carlsbad. I think it's a little before Carlsbad.
I think it's up in Oceanside.
Maybe it's Oceanside. Yeah.
Yeah.
But it will actually now come in and capture a little bit more of the inland. The reason that that is relevant is that we've never approached our Congress representatives because there's a history of not supporting rural areas with Daryl Issa. We haven't had a need, so also those two things went together. As we start looking forward to our potential partnership for clinical services or some of our other strategic priorities, we may want to consider options for federal funding where it's available. With this change in congressional leadership for us, we may want to start making a relationship with the congressman. The reason I'm bringing that up is to this committee is that as we start looking at ribbon cuttings and other events, we'll invite him as our representative. So that's an important thing for you guys as board members to know, that if we are offering this up, we'll usually let you know if we've heard from another elected, whether it's the state level or federal level, that they've been invited to come and be at our event. Mike.
But that would only be true if Mike wins in November.
Correct. Presuming that seat stays Democratic, but from what I've seen, there's no expectation at this time that that seat will flip.
Well, I would be cautious about that.
Oh, absolutely.
So I just want to make sure I understand the trajectory. It's whoever is elected, we would start inviting them.
Absolutely, right.
Okay.
Yeah.
I gotcha.
Yeah. I mean, obviously right now, to your point, Jennifer, Mike Levin is sitting in that seat. If that flips, whomever wins that seat would be who we would approach.
Yeah. I'm glad you're thinking ahead that way. You're always doing that, which is greatly appreciated.
Well, it's going to be important for us as we move forward, especially as changes in healthcare continue. It's important that these representatives know what special districts are, because a lot of times they don't know.
Or they do know and don't care.
Yeah, that too.
Mike would care.
Yeah, he's demonstrated a lot of interest in social issues. Climate change is #1 on his priority list. But there's a lot of different committees that he currently sits on that could intersect with a lot of district business.
Yes. Well, that's good. I'm glad you brought it up earlier than later. Because November will be here in a wink of an eye.
In a hot second. Yes.
Yeah.
So the only thing I thought I would potentially do would be to send a copy of our annual report to that office, so that whoever the congressional aide is can start to be prepared to know who we are.
Yeah, I think that's a soft start. That would be good.
I mean, there's no reason to do a full court press since we don't do that with any other elected office when they're changing.
Exactly,
So
exactly.
we'll just
Yeah.
leave that as is for now.
Very good. Annabelle, how do you feel about that?
Yeah, that sounds good.
Yeah. It's logical and it's careful.
Yeah, and once the seats are known, obviously, CSDA and ACHD to some extent, both of their advocacy legislative committees, whenever there's opportunities for meet and greets with legislators, they often will invite us and try to help get those set up. So I think for next year, I'll probably take advantage of more of those than we have in the past, because again, we didn't have a lot of interested representatives, first of all.
Right.
But we also didn't have as much to showcase. I think now that we're on this edge of all these new priorities coming online, I think now is the time to really push that forward.
I would agree.
Make sense?
Yeah.
Okay.
Makes sense.
All right, well, that was agenda item A.
And only.
It might be small, but it's mighty.
So back to you two, for any additional board comments or future agenda items.
I have none, but I think it's interesting you mentioned, watching the goings on with the, Palomar Joint Powers Agreement, right?
Yeah,
I do think it's interesting that they have progressed this far without the state agreeing to that.
yeah,
It seems dicey to me that they would do that.
yeah, I think from what I can tell, Palomar is trying to put together a package solution so that they can go to the state with here's the problem, here's our proposed solution, and we already have it in place, and see, because there is no good solution.
Correct.
You know, they were already basically not in bankruptcy, but their creditor, insolvent, yes. Their creditor already installed a financial oversight for it. But if they go truly insolvent, the debt stays in the county and the county doesn't want it. And nobody wants to take over the hospitals.
Right. As beautiful as it is.
Very, very pretty.
Very
But
sad.
it's gonna be a bit of a mess, and I think LAFCO also doesn't quite know what to do with it.
Yeah, I think they must be just scratching their head like crazy.
Yeah,
Because nobody's gonna get their report as we wait for this thing to be settled, right?
that I think is part of what's holding up the MSRs.
Oh, I can only imagine because we don't know the puzzle pieces.
Right, that one is way more fluid. And the last time that LAFCO did MSRs for health and hospital districts was 2015, when Fallbrook had just closed our hospital.
Yeah, so.
Yeah,
Well, all these moving puzzle pieces, right?
right.
Meanwhile, Tri-Cities, agreement with, UCSD seems to be moving on.
Right, actually with Sharp.
I mean, Sharp.
Yeah, so Tri-City and Sharp is moving along. They have held many public meetings. There doesn't seem to be any significant concern or pushback on it. It will go to the voters in June.
That's right around the corner.
Which is a hot second. So once it goes to the voters, presuming it passes, they already have a framework in mind of how it will operate.
Now set me straight. Palomar has to have the state agree to their JPA, but Tri-Cities agreement does not require state approval.
I think it does need state approval, but it has to go through the voters first.
Does Palomar have to go through the voters?
You know what? I'm not entirely certain what the mechanisms are.
Right. It's a mystery.
Yeah,
Okay.
I would presume so, since they're talking about an agreement that transfers public assets into.
Much of the resistance from the population because they really are neutering the elected representatives with this thing.
Right, unfortunately for the Palomar situation, there doesn't seem to be, an aware public
Yeah,
of.
it could be set on fire though if somebody wanted to.
Oh, yeah, and I mean, it's
Probably
gonna
don't
be,
want to.
no, it's gonna be interesting to watch, for sure.
Yeah, oh, for sure. Get your popcorn out, Anna.
So, I mean, I'll continue to send those articles, from newspapers as I find them that relate to any of the health districts in the area, so. Right now, Palomar's in the news all the time.
Right.
But as Tri-Cities comes nearer and has more press, I'll send that along as I see it. If I see anything come up from Grossmont or anything, I'll send that over. Right now, Grossmont seems to have stabilized to some extent.
That's good.
Yeah. We're waiting to see, the board has taken the reins, so even though they have a new CEO, it looks like the board will be retracting the majority of the community programming that had been done. So they're gonna looks like they're gonna pull back and primarily fund, Sharp's,
Yeah.
Sharp's, operations.
Well, they
And,
have that brand new wing that I'm sure is expensive.
right, but actually, the way it works for Grossmont is the funding that they provide to Sharp is specific to the Medi-Cal population. And then Sharp uses that as match money with CMS to be able to help underwrite uncompensated care.
Well, that is a very good model.
Yeah, especially if you're not operating programs, right? If we weren't doing anything, this is very much the model that we did. We helped to underwrite, community health systems when they were running our hospital.
Right.
What is interesting is I was speaking with Chris Christensen, the CEO over at Desert Health District. They've had a similar model with Tenet Healthcare, and they have never provided funding to Tenet for this source. They've only ever served as a landlord, so they did not provide any funding to Tenet. So it's a different model, relationship that Desert has with Tenet that Grossmont has with Sharp. It looks like Tri-City is going to be doing a more similar Grossmont model. But I don't know to what extent or what percentage of property tax that Tri-City will be giving to Sharp for that particular partnership. Right now, I recently had a conversation with folks at Grossmont, and with this new fiscal year, 70% of their property taxes are going to be transferred over to Sharp.
Wow.
And that seems to be some level of consternation of whether that's going to be a year over year or if they were doing a one-timer. Yeah.
Very interesting. Well, the lives of health districts with or without hospitals are very layered.
Yes.
Well, Well, I will tell you that the community collaborative this morning was small but mighty.
Oh, okay, good.
Yeah, there were two community groups, Divine Path and the anti-tobacco gal.
Oh, at
from the
BCC.
county.
Yeah,
Yeah, she's very nice, woman. And then, Bianca and I, we had a really great conversation around various community things, and it was great.
yeah, that's small, obviously much smaller than most of those meetings typically are.
Yeah, well, one hypothesis is a lot of school districts are out for the full week,
Mhm.
and maybe parents couldn't get to a meeting.
Oh, that makes sense. And Annabelle is just shaking her head like, yeah.
Yeah. So that may be the case, and, so Bianca was her usual resourceful self and drew us into a meaningful conversation based on the strategic planning for the wellness center, which she's so good.
Yeah,
She's so amazing. So it was really refreshing, and we spent a lot of time on the parents of significantly disabled children who are now going to be dying, and these parents are desperate for ways to place their 40-year-old, their 50-year-old.
oh, yeah,
And it's so heartbreaking to consider what those poor people are facing.
yeah, yeah.
And the money involved, and it was a heartrending kind of moment, but, nothing that we can do exactly, but just being aware,
Yeah, yeah.
So, that was great conversation, so, yeah.
Good.
So, okay, well, I'm driving through the desert wasteland of Lancaster right now.
Ew.
There's nothing for miles and miles. It's so much fun to have somebody talk about, but all of the mountains are covered with snow. They're so beautiful.
Beautiful.
Oh, yeah. Is,
Oh my God, I had no idea. I saw the mountains every once in a while when they had snow on top. Now they're all the way down to their base.
Oh.
yeah, I heard
And
that,
actually,
I heard this next storm may come down to a 3,000 foot level, which is just about 500 feet above my house line.
well, in the Cajon Pass, which I didn't know, the 15 and the 138, that got closed yesterday because of snow. I was lucky to get through today.
Well, are you getting buffeted by wind?
Not too much right now, but Lancaster is famous for their wind, but that's just normal right now.
All right.
But I'm sure it'll be picking up. I hope to be down to Temecula before it hits up here.
Yeah, please drive safely.
I will, thank you. Good to talk to you. And thanks for keeping us aware of these things there, Rachel. We appreciate it.
Of course. Annabelle, did you have anything else that you wanted to add for comment or?
No, I think that should be fine.
Okay. I promised it would be a fast meeting, so,
Okay, all right, well, see you later, alligators.
Okay.
After all, crocodiles.
Toodaloo, kangaroo.
Bye.
All right.
Okay, bye-bye.
Bye.
Close at 5:49.
Bye-bye, butterfly.
You got all the ones.
I do.
Good one, I like that.
Okay.
I got pretty much peace out. That's all I got.
See you soon, raccoon.
All right. Bye, Jennifer.
I can keep going.
That's why I hung up. And we're done recording?
We are almost